Welcome to the Gorman Trubitt Dealership Controllers Roundtable webinar series. Like many others due to the COVID-19 concerns, our June and October Dealership Controllers Roundtable have been canceled. As you've come to rely on our CPE-eligible educational training for 24 plus hours of dealership-specific CPE provided twice a year for more than 20 years, we have decided to shift the Controllers Roundtable meeting into a virtual webinar format called the Dealership Controllers Roundtable webinar series through the summer and into fall. What environmental, OSHA, and pandemic issues face your dealership today? In this Zoom webinar, KPA will introduce you to the regulatory agencies that affect your dealership. It was recorded live as a Zoom webinar on July 21st, 2020, and all information was accurate and up to date at that time. If you have questions regarding this webinar or future CRT webinars, please feel free to email us at askus@lgt-cpa.com, and we will get back to you as soon as possible. Thanks.
Well, good morning, everyone. I know it looks like people are still kind of rolling in here, so I'm going to wait to see. Just wait a couple more minutes for everyone to join us. It's a little strange doing this in the age of Corona, where I can't see everyone's faces. Obviously, on behalf of Trick and Colin, we would much prefer to be doing this in person somewhere, maybe on a beach, getting a cocktail afterwards. But unfortunately, I think we're kind of left to make do with the way things are right now. And for those of you who are joining us for the first time, my name is Reed Crow. I am a principal with Lane Gorman Trubitt. We've been doing dealership-focused CPE for the better part of the last 20 or 30 years from members of our dealership practice. And even though we're kind of forced to do this in a virtual setting, we're still very much committed to pulling together what we feel like is really valuable dealership-focused content. And today we've got our partners with KPA joining us to put on a presentation. LGT is we're headquartered in Dallas, Texas, and while our practice is primarily focused in the Texas market, we work with dealerships across the country. And it's really a passion for us. Our core group, which is roughly 20 to 25 individuals in our firm, is dedicated and committed to the automotive dealership industry. It's an area that we really try to focus continuing education, and the folks in our firm who work in that area really have a passion and a dedication to it. Our firm's been around for over 60 or 70 years, I think. Right now we're about to celebrate our 70th birthday. And I think with that, I want to turn it over to Amanda Rawls from KPA, who's going to be talking about managing, a dealership during the age of Corona, during a pandemic. So Amanda, if you want to give a greeting really quickly.
Sure. So, yeah, thank you for having me. I'm here for all the same reasons that you guys are. KPA is a company that's been around for 30 years, and our bread and butter is devoted to the auto industry. So I just wanted to spend some time today during this conversation to talk about all things that have happened since March. We know that things change pretty frequently in the auto industry, and pandemic is just one of those things for this year, but there's never been a more adaptable or agile industry that can really commit to having safe practices both for our own employees, but also for the customers to keep the economy going. So just to give you a quick introduction for myself, this is me. As I mentioned, I've been with KPA for 12 years. KPA's been around for the last 30 years. I do have a master in environmental management from Texas Christian University. I've worked as a safety consultant for over 15 years and with KPA for the last 12. With that, I do have experience with all angles of the auto industry, from size of groups to where we have our single locations, our more regional groups to where we're going to have multi-locations, and I also help to manage some of our larger automotive groups like the Hendrick Automotive Group and Group 1 Automotive. So with that, you've got my contact information. I'll also show you some of KPA's information and resources that you guys can use following this presentation as well. But I did just want to leave my phone number and my email in case you guys do have any questions later. I have given a version of this presentation to some of our other auto dealer associations across Texas. And without a doubt, there are always going to be questions when it comes to COVID-19. There's going to be individual and unique scenarios that are going to affect your dealership, and everyone wants to make sure that we are doing the right thing. So feel free to reach out if you do have some of those specific questions. For today, I wanted to start off with just introducing some of the regulatory agencies that I'll be talking about. From there, we'll talk about some COVID-19 guidance and protocols. I really wanted to dig into a little bit of the weeds of what we should be doing. There's a lot of things that there's a lot of guidelines that I know that are out there. It can be confusing. We have things that are changing executive orders left, right, and all the time. So I want to make sure that at least for today, you know how your dealership should be best prepared. So we'll get into the weeds a little bit of how we should do everything from accepting the vehicles for work, also greeting our customers, and just how some of our social behavioral changes are going to have to happen as we're coping with the pandemic. So we've got some tips from businesses and our dealers that have been open this whole time. As we know, we've had some lessons learned. We've had some dealerships that have done the right thing from the get-go, and others that were maybe a little bit slower to adapt that unfortunately have seen some clusters hit their dealership. So we are going to spend the majority of the conversation focused on COVID, getting into COVID, talking about all things COVID. But that wasn't all that I wanted to talk about today. Although we know that we've been dealing with this for the last several months, we've had all sorts of other regulatory requirements that have always existed. So I just wanted to bring those to light and to touch on them. Depending on how we are in time and how much we get into COVID-19, maybe we'll lightly touch on them, but at the very least, I want you to know that these other regulatory items do exist. Ask our managers on site if you have a protocol in place for these other items that we'll talk about, and that will make sure that you do have a well-rounded, full-focused safety program for your dealership. So let's talk about those regulatory agencies that I mentioned. This is important just because I am going to be using acronyms throughout this presentation, so I want to make sure we're all on the same page. I know when we hear EPA and OSHA, those are letters that we've heard for a long time already, so, you know, not a huge introduction there. But it's worth noting that EPA is the federal agency out there that is making the environmental regulations versus TCEQ. So I know that we mentioned that we do have some of our partners with LGT that are outside of Texas. I did make the majority of this presentation focused on Texas. So Texas is our state agency, the Texas Commission of Environmental Quality, that then enforces those EPA regulations along with some specific Texas regulations as well. So we might hear about EPA regs, but really the enforcement is going to come from TCEQ directly. It's going to be TCEQ enforcement officers that may come on site to do a surprise inspection. TCEQ is the state agency that's actually going to enforce those EPA regulations. We're going to talk about spill plans, the chemical storage that we have on site. Those are the things that TCEQ, spills, etc. That's what they've been more focused on for your facility. On the flip side, we do have OSHA, which is primarily only focused on safety. So I know we hear OSHA a lot because typically if we do have complaints that are happening from employees, if we do have severe injuries or accidents, this is the agency that is typically going to be coming on site. They do have an obligation to investigate severe injuries and employee complaints, and if you guys are a target industry, so we'll get into that in just a little bit. So I know that one's pretty familiar. But I also just wanted to mention TDSHS. So that's our state health agency, and that's worth mentioning because we're dealing with the pandemic. So a lot of our COVID-19 resources, some of the data and statistics that I'm going to touch on in just a minute are coming directly from the DSHS website, which of course is the state portion of this that is from the federal SHS. So I know that the question that was definitely circling towards April, we got into May with our phased opening, was how and when to reopen your business. But we're an auto industry, so we never really had to reopen, right? We have always been open. Because the auto industry is designated as part of the critical infrastructure, our employees are considered essential employees, especially for sure any of our employees that are a part of our service body shops area. I know it can get a little gray when we're talking about the sales area, but they don't really make that distinction within the regulation. So we're just considering all of the dealership to essentially be those essential workers that we're talking about. So I just wanted to cross out some of those words because I know reopening is a fun thing to talk about, but our world has been in it since the get-go. So let's talk about opening up. Of course, we want to do this in a responsible way, although we've had to be responsible the entire time. Like I mentioned, we'd like to be doing a phased approach as much as we can, and we'd like to be doing that, you know, when we have that downward trajectory of positive cases. Having the number of cases actually are either increasing the testing so that we just know more about it, having that downward trajectory of the positive cases and flattening that curve. We have not done a great job of that, which we'll get into. And of course, we want to make sure that we're also ensuring everyone's safety, because if our hospitals are at, you know, crisis care situations, everyone just won't be getting the care that they need. So there's going to be some challenges in how we're doing that, which we'll get into. So I mentioned the phased approach that has been out there. Again, we've been part of the essential workers from the get-go, but even within the dealership world, I think we've all made some of those accommodations since March. So maybe at the beginning, we were trying to go with phase one, which was everyone's going to telework. We're going to close those common areas. We're really going to limit the essential travel that's out there. And, you know, that's going to be our more strict version. And then we can go all the way up to phase three to where we're back to normal. We are not in the world of back to normal just yet. So we're really sitting at phase two. We're trying to keep our businesses going as much as we can, but also trying to make the safest choices possible. And a lot of what I'm going to talk about today is going to be communication. As long as your employees know your protocol, that is going to go such a long way in this process. Because if our employees aren't making the right choices, they could be the ones that potentially are creating the exposure unknowingly to you. So although we might have some programs in place, which we'll chat about, if our employees aren't following it, of course, that's going to be an issue as well. So if we're centered on phase two, that's when we're going to have some telework optional. If we have some people that can work from home and we can reduce people from coming and congregating inside of maybe a tighter office space, we'd want to do that. As for closing common areas, we'll talk about some good ways that dealerships have done that. Of course, we don't want to take away every amenity that's out there. We can still offer waters and whatnot, but we just need to be more thoughtful in maybe where we're placing that, how we're distributing that, and of course, where our customer waiting areas are going to be more thoughtful for that space as well, and also where people are going to be signing paperwork and everything else. So we just want to think about all those accommodations, and we can't just focus accommodations on just, the healthiest versions that are out there. We really have to think about some of our worst case scenarios that can happen. So we just want to make sure that we are making accommodations for the most vulnerable individuals, which would of course keep everyone as safe as possible. So before I get into the statistics and data, I just wanted to kind of quickly cover the symptoms. I know that we've been familiar with the original symptom list that the CDC had put out back in March. And I know some of this, I keep saying March, but I feel like March is when it was really hitting Texas. We've heard of some of these symptoms from the start of 2020, but the CDC did update their list of symptoms with 6 additional symptoms. And the thing to stress here is that, not everyone has to come in with 103-degree fever to know that we may potentially have COVID. We've seen the types of symptoms that everyone is experiencing. It is a huge range. And I know when you're looking at the list, cough, fever, chills, muscle pain, sore throat, shortness of breath, we're talking about everything that can happen from, just feeling like you have a cough to just another type of flu to maybe it is that I have COVID. So we just have to be as careful and thoughtful as we can when we are experiencing these symptoms and just having an honest conversation with yourself, your family, and now your employer as well. Some of the additional symptoms that got added were just general fatigue, those chills, and also vomiting, nausea, and diarrhea. And I know that no one wants to talk about maybe all of these symptoms with your employer. And again, that's a huge range. I think at this point, we've all probably known someone that has had a positive case, and it may have been as severe as it may have required a hospitalization. But I myself have known plenty of people that have had a positive case that have been able to deal with the illness at home. They've had a fever, but it's been a low-grade fever. I've known other people that have tested positive, and all they had was a light cough and maybe some diarrhea, and it was just that actually prompted them to get tested. So we just want to encourage people to get tested. That way we'll know what those results are going to be. And as we mentioned, you know, any of these symptoms people can experience, but if we do have an older population that is going to be a part of our workforce, anyone that has those underlying conditions, they are going to be feeling these symptoms more severely. So it wouldn't just be some of these mild symptoms that are out there, it could be more severe. So just want you to know that even if we're having a light brush with some of these, it's still worth thinking about and thinking about what the options can be until we know that we might have some test results. So I know that we hear about those COVID numbers all day, every day. It's on the news, and we really can't avoid it. So the purpose of this slide that I wanted to have is just making sure that we do have a trusted resource for where these numbers are coming from. So I did want to give you several options to do that. There's going to be some national tracking resources with the CDC in particular. We're going to have our DHS, which I mentioned, which is that the state of Texas, where you can see some of those blue bubbles that are out there. And then the other picture that I put on there was the Johns Hopkins University. You're going to see all of this reported on a county basis. And unfortunately, with Texas, we have not done a super great job of this. 173 out of our 254 counties are considered in that red severe category. That's about 70% of Texas right now is in the red zone. We'll talk about which counties have been hit the worst. I know we hear about Harris, Dallas County, but basically it's going to be every metro area of Texas. I know that we're going to have some more rural populations up there, and you're going to see the lighter, you know, yellows, tan colors. But probably for most of us that are attending this, we are in the red zone. So we just need to be as careful as we can be. So again, these numbers are changing. I did pull this information over the weekend. I was trying to wait to get as close as we could for this. So at least on Saturday nights on July 18th, you can just see where we are in the trajectory. We have not done such a great job of flattening that curve. We did for a little while there, but we know that we've just had a severe uptick in cases as those phased openings have happened. So you can see the increase of those positive cases. And for these slides right here, this is for all of Texas. It is not just one specific county. So I've got on the top portion of that slide the new cases, and then down below you can see the fatalities as well. And again, you'll see those clusters and those bubbles in same metro areas that are having obviously the higher cases of the higher positive cases. We know we're going to be more susceptible to having higher fatality rates as well. So I mentioned Harris County for sure. Harris County is number 7 in all of the counties in the United States with positive cases. We've got Dallas County. Dallas County has gone 18 days in a row with 1,000 or more cases. San Antonio and Tarrant counties, or San Antonio for Bexar County, we've got Tarrant County, again, all those metro areas. I myself reside in Austin, so I'm particular to Travis County and those numbers. And then of course, South Texas and some of our border areas with Hidalgo County and El Paso County as well have definitely been making the news, hitting the map for the surge in cases that have happened there. It's worth noting, though, just some of the trends that are out there with the cases. And again, this is all of Texas data that I did take a look at. I know that initially we have all been warned about our older population and how they could be more susceptible, but really it's the population that's sitting between 20 and 40 years that are having the most positive cases. And, you know, it's going to be our most social group out there, our group that is going to be a part of our active workforce, so not a huge surprise. But for the cases that are the range of our population, anywhere from the 20s up to the 60s, that's the break. And who are the people that we have working at our dealership today? Those between their 20s and 50s and into our 60s as well. So we are right in that area that is going to require us to be as careful as we can. Although some of the more positive cases are affecting maybe our younger generations out there, those that are in their 20s and 30s are just above when it comes to positive cases. We know that those fatality rates are hitting the age groups that are a bit older. So once you're around 50, 60 years, you're going to start to see an increase. And then from there, you can, of course, see that at the bottom in the shade of yellow. For whatever reason, males are slightly higher for positive cases at about 51% or 53% versus the female population that are out there. And then you can also see some ethnicity trends as well, at least from Texas. So we know that this is a problem. That's not a surprise to any of us at this point, right? But we do want to make sure that you are being as careful as we can, and just also knowing what is going on in your local area is incredibly important. If you're living in Harris, Dallas, or El Paso County, you're going to have different requirements and also different considerations to those in maybe some of those Texas counties that are seeing 20 positive cases or less. So, although we know that it's a problem, we've had lots of guidance out there. You know, it felt like in March when we were trying to kind of wrap our hands around this, there wasn't enough, not necessarily regulations, but even guidance about what exactly we should be doing. And now we're kind of on the flip side to where there's so much out there. It's just which ones do we actually have to follow and which ones do I need to look at for today? So I wanted to start with some of the federal guidelines that are out there, and over these next couple of slides, we will whittle down to what could be more locally affecting you. So let's start with the state of Texas, for instance. They do have a protocol. They do have some guidelines that got released through the TDSHS website. So that's another reason why I wanted to mention it. They're going to have all the information for businesses that they need to follow. That way they could have, so that they can reopen safely. So one of the guidelines for the state of Texas are, we got to train our employees, no surprise, that we need to screen and monitor for symptoms. That way we can battle that. Of course, we need to wash and sanitize our hands and disinfect the areas around here. Social distancing, can't say it enough, going to talk about it 1,000 times later today. We also need to consider the face coverings and PPE. We know that that has changed over the last couple of weeks. And do you have any policies and procedures in place? So, you know, they're specific yet a little general. These are all best practices that businesses should be doing. On the flip side, when it does come to OSHA, this is, like I said, another federal guideline that's out there. They also have guidance about preparing workplaces. Theirs is going to be a bit more specific, though. So if you were a California OSHA, you have very specific items that you have to do. But for federal OSHA, like for us in Texas, this is the list that they'd like us to be doing. So they actually want you to develop an infection disease preparedness and response plan. Having just a plain emergency response or a plain hazard communication, at least for OSHA guidance, wouldn't quite cut it. And we'll talk about some of the other requirements that are out there. People and agencies, it's not a requirement by OSHA just yet. Like there's no regulation that says 1926.436 yet. Right now, all we can really use is the general duty clause. So they're going to say it is your duty as an employer to protect your employees. And the best way that you can protect people is to communicate. And how do you communicate? Through having a written plan. So they want to start seeing verbiage that is going to be more specific to a pandemic, testing, and what your actual protocols are going to be. So there's that. They'd like you to start moving in that direction. Of course, they want you to be considering the infection actions that can happen, and that way we can put in place infection prevention measurements. We want to, of course, identify and isolate sick people. That way we can reduce exposure. We're going to develop and implement and communicate those workplace flexibilities as best we can, like teleworking, for instance, or making other accommodations. We want to implement those workforce controls. And of course, we know that there's already some OSHA standards that are out there that we're going to have to comply with nonetheless. So not only do they want you moving towards more specific pandemic protocols, but don't forget about all that other important stuff when it comes to safety for your employees. So we talked about some general state of Texas. We talked about federal. Let's talk about some more state of Texas items. So we just had an executive order, G828, and that's the one that got released and updated on July 2nd. So this is the one that went back to reducing gatherings and identifying the number of people that we're going to consider groups at this point. So for outdoor gatherings, we can't have people, more than 10 people in an outdoor gathering. They don't want groups to exceed 10 people. And both of these is when we cannot maintain social distancing. So that can even come to effect when it's, you know, getting the whole sales team together to have a chat, or some of just the meetings that we're having, even some of your tech meetings. If you're gathering everyone together, all the technicians, we know that we shouldn't be doing it now, but we shouldn't have everyone tightly grouped together in the break room. Because we can't do that if we have more than 10 people, and if you have more than 10 techs, that's that. But we could do it if we did it in the service department, for instance, to where we're going to have more of a space where people can spread out. So having the number of people identified for a group setting is part of this, but the other big one that I know that we're all aware of is the face covering. So now the state of Texas, I know we waffled on it for a little while, does require everyone to actually wear a face covering when we're out in public and inside of our buildings as well. So this is going to be covering anyone that's 10 years or older. We know that there's some exceptions that are going to apply. If we have any medical issues to where we physically can't wear face coverings, then we can't. If we're actively exercising outside, walking dogs, etc., we don't necessarily have to be wearing one at that point. There are going to be fines that can be set in place. It'll be $250. They'll start off with warnings, but if you are continuously not wearing a mask, then you are susceptible to having those fines. This was effective July 3rd, and at the moment it does not expire. And like I said, things change. So I just wanted to give you a little update or a look back in time at those Texas executive orders that have started to come out since April. We've had new orders and new amendments to the orders come out 8 times already since April. So this is why it's just important to stay engaged with the news. And if you do have any regulatory consultants out there that can just make sure that you're in the know. So now that we've talked about states, I wanted to focus on county. We had over 10 counties in Texas have their judges within those counties prior to the mask change that happened on July 2nd. So this was towards the end of June when this happened, around June 21st, and probably the week before mid-June. 10 Texas county judges started to require people to wear masks within their county. And not only were they going to require masks, since the state of Texas wasn't doing it at the time, but they also had other amendments in place. So I just wanted to use El Paso County as an example to that. Again, Texas has to wear masks. El Paso County would already said that you needed to wear masks, but here's what else that they said that you needed to do. For Texas, people need to wear masks starting at 10 years old. In El Paso County, it's 2 years old. If you are over 2 years old, you need to have some type of face covering that's on. That's different. Again, I mentioned that OSHA wanted to push people towards having a policy with pandemic verbiage. El Paso County is already ahead of that. They are requiring businesses to have a health and safety policy in place. And with that policy, they wanted to have that specific pandemic verbiage in there. They want you to say exactly what people have to be doing and what your protocols are going to be. Not only do you need to have this health and safety policy in place, but they actually want it posted. They need to have it posted so that before customers and visitors, vendors, contractors, whoever's walking in, they knew that they were required to wear a mask. Fines in El Paso County are going to be different. It's actually $500 and not just $250. This ordinance, I shouldn't say ordinance, this executive order for this county was effective on June 21st. I mentioned that there were 10 counties in Texas that have similar language to this. Each county may have had different expirations. El Paso County that I picked, actually theirs does not expire. This is going to be an ongoing conversation that they will be revisiting before they set an expiration date. I mentioned that I reside in Austin, so Travis County has specific items in place, but so does the city of Austin, and so does the city of Houston, and so does the city of Dallas, and a lot of others that are out there. So don't forget that you might not only need to comply with Texas and the county, but also your city as well. So Travis County is in what we're calling stage 4. There's 5 stages that are out there, so that's why we're in the orange and not necessarily the red just yet. But we have the city order number. You can read it there. Again, pretty similar to what Texas is saying. We're going to have our face coverings for people that are 10 years or older. We're going to ban the gatherings that are size 10. Social gatherings, this is what's different about the city of Austin. Social gatherings of any size, should be avoided and minimized. Vulnerable individuals, they're saying that they want to limit their groups to just 2 people. Travis County was one of those that was included to identifying a health and safety policy on place. The other difference that the City of Austin has, though, is they do have specific language for if people in your household are testing positive for COVID-19. If someone in your household has positive or is awaiting results, just awaiting results of a COVID-19 test because maybe they had a possible exposure, the entire household is ordered to isolate and also not travel out of the city at that point. So that's very different language that existed from the county and also from the state. So again, you might have employees maybe from Austin in particular that can't come to work because they're in a household where someone else is either awaiting test results or have tested positive themselves. There are going to be fines associated with the City of Austin. Theirs are just $250. This does have an expiration date for Austin. It went into effect July 3rd and it's going to expire in September. But for at least the next couple of months, this is how stringent our city is getting regarding people even going to work. I'm going to roll into some workplace prevention practices. So what can we do to actually get in compliance? The first thing is you need to have a pandemic response team. And this is a conversation that I'm having almost on a daily basis at this point with my dealerships. You probably are very likely have a safety committee in place already. Everyone should have a safety program of some sort that's out there. So we should be looking at issues, we should be correcting them, we should have some follow through. If you'd like this safety committee to morph into your pandemic response team, because this is part of safety for your dealership, you can do that. If you want to have a different group and different managers get involved, that can work too, but you do need to have some accountability and responsibility coming from the top of your dealerships that are out there. So if we are gathering this group together, we should have a defined goal of course, trying to put those protective measures and infection prevention measurements in place. We need to have some ownership that I mentioned. So we need to have someone that's going to be in charge. We need to have that accountability that we can assign responsibility of some of these takeaway and follow through items to different committee members. Probably at the beginning of the pandemic, you were meeting more frequently. I know as rules change, we're going to meet again. You're probably meeting weekly and then maybe every 2 weeks as the situation changes. If you suddenly had a positive case on site, of course you would want to meet because you need to start talking about how we're going to respond to that. If you start to actually have a cluster of positive cases, you definitely need to be meeting on a daily basis at that point. I would encourage anyone that is having these types of teams getting together to take some meeting notes. At the very least, we do need to know who's involved, what dates you're meeting, some of the general items that were discussed. We'll talk about how we may need to report some of the illnesses to OSHA. And if OSHA does come on site to investigate maybe a cluster of illnesses that may have happened, this is one of the first things that they're going to ask for. Who's deciding, who's meeting, what was discussed, and what was your best effort? And that really is the question that they are posing to businesses out there. So as for who should be a part of this team that I mentioned, it should be your top executives. You are, of course, going to need to involve HR. We've got some really tricky situations that can occur. No one wants to be singled out. No one wants their name, and we'll talk about that, shared that they were a positive case. So there's a lot of sensitive information, and this is really going to cross a lot of boundaries when we're talking about health and medical information, and balancing that along with, again, keeping our employees protected. Your legal counsel should be getting pulled in as you guys are creating these programs. We don't want to do anything that's so authoritarian that anyone's going to feel offended. We can't single out any specific groups or even specific departments. Of course, we're going to have different risk factors associated, which we'll talk about, but we can't say, everyone that's pregnant needs to go home today, or anyone that's over the age of 60 needs to go home. Obviously, I think we're all smart enough to know that we can't do that. But if you're even considering some of those questions, then this is when HR and your legal team are going to be involved in that. The other people that should be involved, are going to be your facility management team. Nobody's going to know your shop best than your service manager or your shop foreman, the people that are actually going through the daily motions and activities. So when we start to consider the risk factors that are out there, we should be talking directly to those employees that are doing their activities on site to know that we've taken all those best prevention practices. We've thought about them ahead of time, I should say, and that we're not going to, make them do something that doesn't make sense, or maybe they're doing something on site that you haven't thought of because you're just not in the shop. So just make sure that we are involving input at the very least, some feedback. We need to know if these programs are successful, and the people that are using them every day are going to be the best to tell you that. Okay, let's talk about some of that workforce planning. So we're going to have to start to make some of those considerations that I mentioned. Those work from home options are going to be great for those that are maybe involved in the office, sign in remotely, for instance. If we're doing, having people doing our business development that can make phone calls from home, these are all options. I know that this is not going to fit everyone for sure, because we can't take cars home to get work done. We're obviously going to have to do that in the shop. So maybe it's a matter of shift minimization, or just managing shifts in a different way. Maybe we're just, having more of a waterfall effect of when people are coming in. Maybe we're not changing the start time of work, but we are adjusting when lunch times can happen. That way we don't have clusters within the break room. We're going to have to just change the social behaviors. I know that we have some close relationship with some of our customers. We're used to doing the handshake. We're used to doing the high five. And at this point, we're all politely just doing the wave, saying hi, thanking them for their business, etc. So we also just need to consider our sanitizing efforts and disinfection, which we'll talk about. We need to look at those high traffic zones where people are crossing. I know that we've mentioned social distancing already, but there's going to be some areas, if you have stairs, for instance, to where you can't really limit, the hallway doesn't get wider. So if we have lots of people walking at the same time, we should think about that. You've seen, at Whataburger, if you go, for instance, for some of those that have dining options that are open, they have one door that you walk in and one door that you walk out. And the reason why they're doing that is so that not both people are walking through the same door. We know that we can't always limit the visitors that are coming, but that's where signage and some of that communication can come into place. That way we can maybe redivert some of those higher traffic areas that may have happened pre-pandemic. I'll mention some engineering and administrative controls that we need to consider. And again, I know I keep saying it, but those written policies are going to be really, really important if we do get into any legal action, or if we do need to support the evidence of the efforts that we've been making on site to any regulators. So with this part, I just wanted to pivot to a risk assessment. So once we do that, overall for the auto industry, we're going to be sitting on the lower risk category for this. And when we're saying that, we're going to say because we can make a lot of accommodations on site. If you're looking at, the lowest risk out there, that's people that are working from home and don't have to be around other people. If you're that lone truck driver on the road, then sure, you're not probably as worried about it. Getting closer to maybe, higher or lower, you're sitting closer to that medium risk is where the dealership world is going to be. There's a lot of our workforce that does get to sit at areas that are spaced out. We know that our techs are spaced out, body techs, etc. So we're really, more mindful of some of those spacing issues when it comes to our offices and lounge areas, etc. When you're looking at this pyramid in particular, of course, our healthcare workers, our, emergency responders are going to be sitting at that high risk and very high risk. People that actually have an anticipation of coming in contact with people that are positive for COVID are going to be sitting right at the top of that pyramid. So knowing that, in the grand scheme of things, we're kind of in that lower to medium risk category, at that point, we really just need to start taking a look at each of the individual positions and what their risk category is going to be. I know that I've mentioned service and that we can be sitting in the service shop and have some socially distanced area. You can pretty much work by yourself and go on about your day. That same accommodations can't be said for probably our sales team that's out there. So just wanted us to be mindful of that as well. So when we're looking at this workplace assessment, you're going to see the different accommodations that we can make out there. Of course, eliminating exposure is the number one thing that we would like to do, but it's not always going to be the most realistic option that we can make. Temporary closing our facility means that we're going to have no risk that's out there. So as I mentioned, that can't happen. With the substitution, for instance, that's when we can start to work remotely and we can have those work environments. The engineering controls, those are going to be our physical controls that we can do to kind of shape the workspaces that are out there versus the administrative controls that have some social distancing and sanitizing efforts. When it comes to our personal protective equipment that's out there, that's when we're talking about our face coverings and the gloves. And when we're wearing that, it really should be our last line of defense that exists. So we really want that to be the end game. We want to adjust our physical workspaces as much as we can. We want to change the social behaviors, and then at the very last thing that we can do, that's when the face coverings and gloves are going to happen. So we know that we'll still have to make some of those accommodations on site, but we just don't want that to be the only accommodation that we're making. So let's talk about these prevention practices that are out there. I mentioned the engineering controls. These are the physical barriers and the physical things that we can do on site to make those adjustments. So if we can isolate employees and just start to spread them out, if we can start to isolate some of those customers as well, that's what we'd like to be doing. We know that we have some of those shared spaces with the coffee stations, the donuts, kind of the snack areas, the customer waiting areas. At this point, this is when we can actually start to remove some of our chairs. We can start to have the ropes. This is when we're going to see some of those stickers on the ground that are going to alert people to be making some of those adjustments that are out there. If we need to close specific areas of the dealership to help accommodate that, then we can have some of the signage and the ropes that are going to be in place. For the administrative controls, I mentioned that this is going to be the social things that we can be doing. I know that, again, we mentioned, you know, the high fives, the handshaking, the hugs, the slaps on the back that we used to do, but we're really going to be in more of a no touching mindset from here on out. We do want to accommodate that social distancing at 6 feet as much as we can, and, you know, washing hands frequently is just something that we're going to have to do. We're going to have our sanitation stations that are going to be scattered around, so we do want to make sure that people are using them. We can also think about some of our meeting areas as well, also where people or customers are meeting with your sales team to help sign paperwork. We should be having them spaced out in maybe every other seat. I know when we have our households that are coming together as couples or whatnot, of course they can be sitting together, but we do just need to think about the tables that are out there, and at least in, you know, the spaces where people are waiting, having less chairs that are going to be around there. Some of the suggestions that have come out there are people actually setting timers, and that's just to encourage the frequent hand washing. So you could either do it for yourself with a self timer, you could do it per department. Of course, we don't want everyone getting up and then going to the bathroom at the same time, but you know, if you're just setting an alarm to just remind yourself to wash your hands maybe once an hour or every couple of hours, that is of course going to be helpful. And then things like having touch screens so where everyone's touching them, we'd like to limit that as well. One of the other items that we've had one of our dealer groups think about are pens. You know, when you're going to sign the paperwork, everyone's using the same pen. Ooh, you know, might feel a little funny. So we have had an increase in some of the disposable pens that are individually wrapped that they're unwrapping and handing to the customer to actually use. So just some pictures to help go with that. I think we've all seen the, you know, at least the strips of tape that are making their way onto the floor. If you just need to throw some exits down, you can see how rudimentary it can be. And you've seen the nicer signs that are printed to where they're actually spacing out the 6 feet of distancing as well. So use the sanitation sessions, have those hand washing schedules, and communication is going to be key. Not only for your employees that are on site that need to follow this, but also for your customers that are walking in that may not be as familiar with your process. If you don't have this outlined for them, then they just won't know what to do. Okay, the other thing that we need to consider is going to be supplies. We, of course, want to have a nice good inventory of the soaps, the disinfectants, those sanitizing stations that I mentioned. So when I know at the beginning of the pandemic, some of this was a lot harder to come by. It feels like at this point, when it comes to supplies, we've had a better flow of that. So we just want to make sure that your chemical inventory is going to be up to date with some of these newer chemicals that are out there, and that we do have those safety data sheets posted as well. When it comes to disinfecting your facility, you can see this list that is coming from the EPA. With that, it's going to have the actual chemicals that are designated to actually fight the coronavirus. So you can visit this table, you can visit that website, and that will show you which chemicals it can do, or which of those chemicals will actually fight the virus, because that's what we want to be careful of. Just because it says antibacterial, that doesn't necessarily mean that it's going to kill the virus. The other item worth mentioning is just going to be the contact time. And there's going to be an amount of wet contact time that's going to be needed. So we just want to make sure that you are using all of these chemicals appropriately. Some of those time limits are going to change, so whether it's 1 minute, 2 minutes, 30 seconds. Again, you just want to make sure that you're using it correctly. Otherwise, it's not going to be, worth the effort. And with that said, we also just need to be mindful of the type of surfaces that this disinfectant can actually cover. So some are going to work well on some of our harder surfaces, where others are going to work better on some of our more porous surfaces. So again, just want to make sure that you're going to effectively be using it out in the shop. So when we're doing that, we just want to think of the do's when we're doing that and not necessarily the don'ts. One of the most important things that is going to come to your attention is keeping track and a log of your disinfecting efforts. If we have had any positive cases, we of course need to do a thorough cleaning of that area. And it's up to you on whether you need to bring a third-party source that's going to come in to do that, or whether you guys think that you can effectively clean on your own with your own janitorial housekeepers that may be a part of your business already. You may already have a vendor on site. We do want to make sure that we're applying that disinfectant, that you're keeping it on the surface for those designated times. We would recommend that you're using a microfiber cloth instead of just a terry cloth. Those terry cloths just tend to hold on to some of those germs a little bit longer. We don't want to use the same cloth in every single area of your dealership, for instance, because we might just be spreading germs at that point instead of cleaning them up. And the log that I mentioned is going to be important. I know that we get used to, at least pre-pandemic, of keeping track of some of our restroom logs, but this is going to be important for even just cleaning those high-touch surfaces that are out there. Once we may have had a positive case on site, this is one of the first things that OSHA has asked for is how often are you cleaning? What are your efforts? And you can say that, hey, we're doing it every hour. Hey, we have the sanitation stations. We are wiping down our own workplace areas. But if you can't actually prove it, then did it really happen? So we just want to make sure that your janitorial staff is keeping up with how often they are actually going out there to mop or wipe up some of those high-touch areas, doorknobs, etc. It's worth mentioning with the newer chemicals that are coming on site, they can be pretty potent. So some of those chemicals out there, you may just need to be considering that they may need to be diluted. Some of them are going to have their own safety hazards associated because of the potency that could be a part of it. So we just want to be mindful of the globally harmonized system that's out there. We need to make sure that all of our containers are properly labeled. If we suddenly have an increase in the number of spray bottles that are around and maybe they all have Clorox in them, then it needs to say Clorox on it. We don't want to inadvertently, spray chemicals or misuse them, and especially if it's not labeled, you won't know exactly what you may have come into contact with. I'll talk about an example later today where we did have a cluster, which did unfortunately lead to a fatality. Because the fatality was COVID related from a dealership, they did come on site to do an investigation. When they did that, they did have employee interviews with the managers and also with some of the sales team. And then they also did do a kind of miniature walkthrough. They walked through the sales area because that's where this particular person had been working. And then they also walked the service drive as well. When they did that, the one thing that they picked on out of everything that was COVID related with this fatality was labeling. What they noticed is that they had a Clorox disinfectant machine that they had purchased, and the Clorox bottle itself, which did come directly from the retailer, did not have these GHS pictograms. Those little red diamonds that you're seeing right there, it wasn't actually on the bottle, which wasn't necessarily the dealership's fault. The bottle wasn't labeled appropriately from the retailer. But that's what they picked on. So I promise you, whether they're coming on site for COVID, this is why I'm going to mention some of those regulations that are out there. It can be as little that they might dig into as to, was your bottle labeled properly? To continue the conversation about disinfecting the facility, there's going to be different procedures when it comes to the building versus the vehicle. Obviously, with our technicians, detailers, others that are going to be sitting inside, this is a closed space that the public has been inside of. So we definitely want to not only disinfect for the safety of our employees, but I know that our customers are also worried, well, when I get my vehicle back, this guy's been at a bunch of cars, so is that going to be clean? So I know that we're doing double efforts to making sure that the vehicles are disinfected. So again, the different areas that we're going to be addressing with the buildings, those high-touch areas that I mentioned, the furniture, the railings, light switches, versus the vehicle, you know, we also are going to have our high touch areas within the vehicle too. Obviously, where we're opening and closing the door, the steering wheel, the drive stick, you know, the radio controls, the air vents, etc. So you can see some of that and where the NADA did give some guidelines as for disinfecting vehicles as well. And I think at this point, everyone's pretty familiar with the different options. I've seen kind of those like fog machines that people are putting in there. And just kind of rolling up the windows and letting it sit for a little while. We've seen others that are doing kind of a direct wipe down. When it comes to PPE, I mentioned that this is our last line of defense. So I know you wouldn't think that with gloves you really have to give too much training about gloves, but I'll talk about the proper procedures for donning and doffing them. We want to make sure that all of our gloves are in good condition. If at any point they're torn or damaged, then of course they're not going to be working as effective as they should be. A latex and nitrile glove is going to be suitable protection for the coronavirus. And I know that our technicians were already wearing gloves. You probably already spent a ton of money on gloves already. And unfortunately, you're going to spend like so much more money on gloves. Not only is gloves going to be needed for the multiple vehicles and multiple touch areas for your service and body techs that are out there, but we also are going to need this for our service writers, our salespeople, and other employees throughout the facility. When we have these disposable kind of one-time use gloves, we really shouldn't be reusing them. I'd like to discourage kind of that snapping of the glove. I know it seems kind of fun and cool, but that can lead to contaminant splashing. And then the other thing to note is that we really shouldn't put gloves over our jewelry, our rings, our bracelets, or even our watches. Obviously, that's going to be because it's going to damage it. So if we have any pointy parts of the jewelry, etc., it's going to poke right through, and then it's like we're not wearing gloves at that point. So I wanted to switch the conversation to some of the respiratory personal protective equipment that is out there. I know that we've seen the surgical mask and the face covering versus the N95 respirator. And really, there's going to be two different considerations that we should be making for that. When it comes to any type of PPE, I mentioned that we need to talk about training any of our employees on the proper use of it, how to don it, how to take it off, how to properly dispose of it. And then for the face mask, you can see an example with kind of that surgical covering. And the face mask or face covering, we've seen all versions of this, from, you know, scarves that people are putting over their face, a t-shirt, a bandana, like we're making them on our own, we can buy them, etc. So these are of plenty, and you don't necessarily need to wear an N95 for the majority of our employees. But for those that are possibly working in, well, I should start off with this. With the surgical mask or the face covering, this is going to be great for keeping your droplets and any of your respiratory, you know, sneezes and coughs, etc., contained to yourself. So we still need to be careful about how we're wearing this and using it, because you don't want to cross-contaminate it. As we know, the face covering is going to be required in all areas of our dealership, so you're used to seeing this. If you are sitting as an individual within your office, you are not required to wear it at that point, but if you get up and down pretty frequently, then you need to probably have that be hanging on your ear. If you are going to be using kind of that cloth covering, you can see some that are more of disposable nature, like the surgical mask. Versus some of the bandanas and t-shirts and, you know, scarves that people are wearing, to where you wouldn't want to wear that the whole week. After your day of use, at that point, you would need to wash it, and that way you can, excuse me, wrong button, then you can reuse it. When it comes to our N95 respirator, though, this is a different story. And, you know, this is great, and this is why they were out of stock at the beginning of the pandemic, because this is going to regulate down to the particulates of 95 microns. So with that in mind, this is going to have the most protection. Well, it's going to have more protection, I should say, versus that face covering. They are reusable, which makes them very nice to use. And this may have been a required respirator that your employees were wearing already. So you may have had a few of these in supply, especially when it comes to our body shops that are out there. If they were doing any undercoating, if they were, you know, welding, etc., then they already had these boxes of N95. The thing with the N95 is that this is considered a respirator, an actual respirator, and this is going to be considered a tight-fitting respirator. With these surgical masks and the face coverings, they're loose, so there's no extra regulations besides that we should be protecting ourselves with the pandemic. With these N95 respirators, you can see where we've got the band at the top and where we're going to have the ear loops. It is going to be sitting tightly to your face. Because of that, it is considered a tight-fitting respirator, which means that you need to have a written respiratory program. Technically, anyone wearing an N95 needs to have a medical evaluation because it is a little bit more effort to be wearing that, and they need to have a fit test on site as well to test for the fit of the mask. We'll get into this, but I will say that OSHA has relaxed their enforcement regarding respirators and the N95s in particular, just because there's not enough people out there to do fit testing, and generally we do want to make sure that everyone is feeling good. Basically, it's going to be more important that we are protecting someone during a pandemic versus not wearing one because you're maybe not meeting that OSHA regulation. I did want to mention Appendix D in the voluntary use form. With that, basically I mentioned that you needed to have a medical evaluation and the fit test. And we do need to have that unless you have an Appendix D form signed. By having the Appendix D form signed, you're basically exempting yourself from having to do that. So we just want to make sure for any of your salespeople that are possibly wearing that N95 mask, they may have been doing it. Excuse me, I just need to catch my breath for a second. I don't know why I'm getting so lightheaded right now. I know that some of our salespeople might be wearing the N95 mask, and when they're doing that, I know that they're doing it for their protection, but just to avoid having to do the medical evaluation and everything else, just make sure that you have that Appendix D form signed. It's just a piece of paper that's going to say that they are wearing it in an atmosphere that's conducive to its use. When it comes to wearing your personal protective equipment, we just wanted to make sure that you are wearing it correctly. When it comes to putting on our gloves, we just need to put them on, and really it's more of how you're taking them off that we want to make sure that you're doing correctly. So once you have your gloves on, you're going to put them on, you're going to wear them. We just need to be mindful of what we're touching. One of the fun things that we've seen some of our dealerships do as part of training is to use some, what's the word I'm thinking of? Shaving cream. So if you put some shaving cream on, if you put your gloves on and put your shaving cream on, and then ask them to grab their phones or do something else, see how people instinctually will try and grab that. Also, once they have a little bit of shaving cream on, you're going to notice whether you're touching your face or you're touching other surfaces that you shouldn't do. The other test with the shaving cream is just going to be if you can correctly take off your gloves without getting shaving cream on you. So if you have that on your hands and you have your gloves on, what you want to do to correctly take off your gloves, and this is, for more of our techs and others that are out there, is you're going to take your other hand and just poke at the bottom of that glove, turn your finger this way, and that way you can peel that glove off backwards. As you're doing that, you can kind of grab that used glove in this hand, and now with your clean hand, you're going to do the same thing on this side. Without touching the outside of the glove, you're just going to pinch in, pull it back, put that glove in your hand, and throw it away. If you can do that correctly without getting shaving cream on your hands, then you know that you are wearing your gloves correctly and also taking them off correctly as well. So as I mentioned, with some of our face masks that are out there, OSHA has relaxed the standard of having the having the medical evaluation. They would prefer to have you guys have Appendix D on site. They want to make sure that you're making a good faith effort to obtain an N95 respirator where possible. I know that you may not need an N95 for every employee within your dealership, but as I mentioned, if it's a body tech, this is something that they would have already needed. I know coming across supplies a month ago was a bit harder, but it seems to be that we can actually have enough of these that people are ordering, or we haven't necessarily seen the shortages that we had been expecting. The other item that we could possibly accommodate, especially when it comes to your painters, is to consider using a fresh air system. At that point, you wouldn't have to worry about respirators because they would just be wearing the hood around them. So when it comes to sanitizing your hands, we've got our hand sanitizer versus hand washing. Hand washing is still the preferred item that we're doing according to the CDC. So any bar soap, any soap that's out there is going to work appropriately. It doesn't have to be a fancy soap. It can just be the bar soap. The temperature of the water also is not going to matter. It would need to be boiling to actually kill the virus. So if we can't do that, then let's at least use a temperature that's going to be comfortable for you and your employees to be using. The important part about hand washing is that we're doing it for at least 20 seconds. So it does feel longer, but do make sure that we are keeping up with that. As for the sanitizer that we're purchasing and using, we just want to make sure that it does have at least 60% of the alcohol. So do note that on the back if you're making those purchases. It's not going to get rid of all types of germs, so just be aware of that. And also, we do need to make sure that you do have generally clean hands before you're using sanitizer, especially for those in the body or the shop, for instance. If you have grease, dirt, and other items like that, it could be creating a barrier, which is not going to let the sanitizer actually clean your hands. So especially when it comes to the shop, we want to make sure that we're actually washing our hands as best we can. These next couple of slides are just quick little graphics about what we should be doing. We want to make sure as we're arriving at the workplace, you're putting on your gloves, you're going to your general area, you're not having that skin contact with people, you're getting your cleaning solutions, and you're disinfecting your workstation. At that point, you can take off your gloves and throw them away. And I know potentially you're going to be doing that multiple times throughout the day, but washing your hands for 20 seconds and frequently is definitely one of the more important parts. When it comes to social distancing, you're going to see the different areas that we do need to consider. Bathrooms is one of them. It's just one of those tighter areas that we can't necessarily keep people from using, so we just need to be more conscious of how we're using it. Same with our break rooms. You should be putting up a notice that says exactly how many people that should be in there. That way, as they're opening the door, if it says 3 people only and 3 people are already in there, then you know that you just need to revisit the break room at another time. Visitors, again, if you have any specific items, maybe you want to designate a drop-off area, we can do that. For conference rooms, we can limit the number of chairs, and if we can encourage those virtual interactions and limit that contact, then that's what we'd like to do. All right, so I was going to go into employee health monitoring and some of the test screening procedures that I know have been floating out there. It's worth noting the EEOC, that's our agency that's out there that's going to be worried about disabilities and some of our private information when it comes to your health. So there's going to be some ADA restrictions out there that we just need to be conscious of as you guys are considering incorporating this into your program. So temperature checks is one of those things that people are doing out there, and we want to do the contactless check if you can. Just be mindful of the type of contactless thermometer that you're using. I've seen some that are going to be infrared and some that are meant for humans and some that are not. So definitely be mindful of the instructions that are out there because it will say clearly on there whether it can be used on humans or not. Some of them are just, you know, temperature gauge readings that are out there and not necessarily for to be using with, you know, human interaction. So it's kind of nice to be checking for fever because it's just one of those symptoms that either you have it or you don't. You can document it, you can have a log, so that seems fairly easy. You can require your employees to do this type of health screening because of the pandemic. We just need to be mindful if you are keeping a log, that log is then considered a medical evaluation. So we can't just share that openly. We'll talk about some self-checks versus having maybe a process in place or trained team members that are actually hosting this. But if you're going to do a self-check, you can't have a self-check and then just like a log on the wall where anyone can see what that fever was going to be. So do you guys know what a fever is considered in Texas? It's actually going to be 100.4 degrees. And although the fever is a symptom that we can easily check for, it's not the only symptom of COVID. So we know that we can have an onset of all these different types of symptoms that are out there that can happen from 2 to 14 days. So with that, I know that some people have had a questionnaire that's going to be developed. We can't ask about any health condition. We do have to keep that narrowed to what those conditions can actually be. So these are some of the questions that I pulled about this. Can employees take the temperature check before they enter the facility? The answer is yes, but just know that that is going to be a medical evaluation. So we just want to have a reliable, effective protocol in place. Can you require your employees to take their own temperature? Yes, you can. It can be self-checking, but again, just be conscious of where other coworkers could be looking at that information. I have had others just kind of use an honesty policy. Employees are required to check their temperature, and if it's over, they're just required not to come in. There's not necessarily a log associated. So can you do more than a temperature check and actually have a questionnaire? you can, but like I said, it does need to be tailored to the actual symptoms. You can ask about, complications with breathing or having a headache or other items, but we just can't ask about anything and everything. Okay, so I know we're going to start to get into the question of, we do know someone that has tested positive. Can I share the name of that employee with my other employees? And that way my other employees will know whether they've come into close contact. And that answer is a clear no. The ADA will prohibit the name of an employee. All we can say is that you can share that a coworker has had an increase in exposure, but you cannot say the person's actual name. So can you release their actual health information? So some people might want to know, well, how sick were they? Well, we can't do that either, because we can't say how sick they were, because at that point we would have been identifying who is sick. So again, we do have some generic language which you can read towards the bottom of that slide, that we have had some increased exposure that they should be taking into consideration. So when we have had an exposure at work, we just want to pre-screen for those symptoms as much as we can. We need to be able to self-monitor our symptoms. We need to be able to wear a mask and gloves. We want to social distance, and of course, we need to keep up with disinfection as much as we can. And all of these, if they are put in place, will help to reduce the exposure of your employees. So let's talk about the different departments that are out there. When it comes to the service department, we're going to ask our employees to wear gloves for each vehicle. Again, we want to limit the touch screen, the computers, sharing of the computers as much as we can. If we can limit tool sharing or at least have a disinfecting process in place, that's what we need to do. We need to have some regular cleaning procedures and protocols in place for that area, again, because it's a lot of shared areas. We need to have some soap that, of course, is going to be provided, which can lead to hand washing. And we need to limit the interaction with the service techs and the customers as well. And if we can, it's always nice to increase the ventilation. So if we can have the bay doors open, that's what we'd like. And we also need to make sure that every employee, including those in service, are trained on those procedures and processes if they do change.
Hey, Amanda, let me know when I can interrupt real quick. I got a question. In a small business setting, how do you keep employees from conversing about someone who tested positive if it becomes obvious when someone is out? How would you suggest they handle that?
You're not going to be able to keep people from gossiping on site, but what we can do is say how they found out that information. You need to be able to say that it did not come from a manager, it did not come from an email, it did not come from a sponsored piece of communication that came from your dealership. So, I mean, we can only control so much. We just need to make sure if you do have a manager that might be someone who's sharing who it is, that we immediately stop that and remind them that we're breaking privacy policies at that point.
Okay, thank you.
Okay, when it comes to the sales departments, again, we just need to be changing some of our social cues that are out there. We should be wearing face coverings because we're coming into a direct contact with the public. We should be wearing gloves as much as we can. Again, we just need, this is some of our most high touch areas are going to be in the sales area. So we need to just be mindful of the equipment that they're touching, the pins that they're using. We need to have lots of hand sanitizer in this area in particular. If we can do deals outside, great. I know that that is going to be a harder conversation for Texas. And again, just the personal contact we want to be limiting. And then of course, we're going to have policies and procedures. We didn't have required face masks, now that we do. When those changes happen, our employees just need to be communicated to and updated. Okay, let's talk about some specific questions that I've had from dealerships. One is that infectious disease and response plan, and like, what do I do? How do I create one? There's going to be some that are out there that you can Google, so start to look for those, and that way you can start to see some of the HR verbiage that has been incorporated into it. There's going to be some OSHA references that may need to be incorporated in it as well. What I will say is, when OSHA's on site, the thing that they're asking is, what was your best effort to protect your employees and customers? If you can't identify what that is, if you're saying that I have an email here, a memo there, etc., that's not going to be enough. They want to know what was your actual plan that is in place, and an all-encompassing one. So I mentioned this fatality that we had on site. This was one of the first questions that we had. They were able to point to some of the communication with their employees. And when they did that, it was an email here, it was a memo there, it was what we talked about at this meeting, what we talked about at the other meeting, but none of that was pulled together into an actual plan where they could say, paragraph 2, here it is, this is what we're doing. And you know, again, it's not a requirement, but it was just definitely looking for you guys to be moving in that direction. So I would just prompt you guys to consider some of the different pieces that have maybe been out there individually and start to wrap that into an all-encompassing plan when you can. I work for KPA. We do have a COVID-19 safety program. We've got some software that's going to be with that. It's going to include training for employees. It is going to have a customizable program. So this is one option, but there's other options that are out there if you'd like to grab some of that information that is available online. So if you guys do have a suspected case on site, of course, we want to make sure that you're protecting yourself and them by making sure that you're wearing the proper PPE. We'd like to isolate that victim. We need to make sure that they are getting home safely. If they are experiencing the symptoms, we need to notify HR and also their medical care and how we can get them to the doctor to get that taken care of. At that point, if anyone is experiencing symptoms on site, they need to not be at your workplace. They have to go home, and then they really shouldn't come back until their symptoms have subsided, or at that point, they've gone and got tested, and until they have their test results, they won't be able to come back. If we've had a confirmed case, which we'll talk about, there's going to be a necessary plan that needs to be put in place. So there's going to be different considerations between, well, I just don't feel good, and I know that I have definitely tested positive. Okay, so if you know that someone has tested positive, and at this point it's kind of just a matter of when, if it hasn't happened at your dealership just yet, there is going to be an immediate response. We need to make sure that any employee experiencing symptoms is telling their supervisor, that way they can stay home before they actually come on site. If anyone develops symptoms at work, they need to be sent home and separated at that point. If you are a sick employee, you do need to follow the CDC recommended steps. No one can return to work until they have discontinued the isolation requirements set out by the CDC. And we also just need to consider our other household members. If you have a sick family member in your house, then you also shouldn't be coming to work. You need to notify your supervisor because you have a known exposure at that point, therefore you should not be exposing others. So I will say that on June 4th, the CDC did update their guidance on what was considered close contact. And this is really meant for community spread. So if you're hearing at work that someone in a different department may, a person, I shouldn't say someone because we should know their name, a person in a different department has tested positive, you're wondering, well, was I in close contact enough to where do I need to self-isolate? Close contact, according to the CDC, means that you spent less than 6 feet of space in between you guys for longer than 15 minutes. So if you were that person that maybe had a close conversation with them that lasted for a meeting, then that is considered close contact. So at that point, the CDC is now asking you to quarantine at that point and to self-monitor for your symptoms. If you had a very distant interaction, if you didn't talk to them for very long, if you were sort of like two ships passing in the night, then at that point you wouldn't necessarily need to quarantine. But we just need to consider what is considered close contact, because you'll hear that a lot with some of the guidance that is out there. Also, we just need to do our part to not only protect that employee that might have had exposure, but all of those other employees. Again, we need to, if someone does test positive, alert our other employees of their potential exposure while maintaining that positive employee's privacy. For anyone that was in close contact that I just mentioned, it's going to be up to 2 days before the symptom onset. Everyone within that time period should be notified. That's not only going to be your employees, but that could potentially be visitors, vendors, customers' vehicles if they've worked on them or interacted with them. Those are conversations that we need to be prepared to have. Any exposed employee does need to self-monitor for their symptoms for the next 14 days. And then again, we shouldn't be coming back to work until you can discontinue the home isolation. And we'll go over what that criteria is going to be. So at that point, we just need to step up the disinfecting and sanitizing procedures around here. And at that point, our employees are, we are now mandated to have the employee paid sick leave. So everyone is going to have, there's very few exceptions out there, but 80 hours of paid sick leave, either for yourself to get better or for other household members if they do need to take care of them as well. So when can an employee return to work? They tested positive, they're ready to come back. These are the state of Texas guidelines, so it is worth mentioning that if you're not from Texas right now, you need to look at your state's requirements that are out there, and there's going to be two different sets that we need to consider. One is if your symptoms have resolved, so you experienced symptoms the whole time. The other is you never had symptoms, but for whatever reason you did get tested and it turns out that it was positive. If your symptoms have resolved, then you can read through what we have there. We need to have at least 3 days that have passed since your recovery. And again, no fever, you're not taking Tylenol for it, and at least 10 days since symptoms first appeared. So we can go with kind of a symptom-based strategy, and really you just have to go on the honor program with your employees to make sure that they're being honest about those symptoms. So, you know, up to you guys if you want to do that route. The other that I would recommend is going to be the test-based strategy. So with that, we're actually looking for positive and negative test results. And this is nice because there's going to be an actual piece of paper that you can say, here it is. This is basically my doctor's note. We'll talk about whether you need that or not. But with the test-based strategy, you can actually point to the negative test that came from the doctor. And that'll be good for you guys because you can say that I now know that I'm not exposing my other employees because they now have the negative test. So if you're going to do the test-based strategy, you're going to have 2 negative tests that are spaced at least 24 hours apart. And with that test, it's not the antibody test, it is only the nasal respiratory PCR test. So you'll note in red down there, that antibody test is only testing about prior exposure. It does not test for an active infection. So it's very important that you guys are considering what kind of test you're evaluating before you consider letting someone come back to work. It needs to be that respiratory specimen spaced out 24 hours. All right, I wanted to move into that OSHA recordable and reportable. I did mention that case, unfortunately, about our fatality that happened. So the scenario there was that we did have a sales manager who at the time I don't think knew that he was infected, but did eventually get tested. And then it turns out that this dealership ended up having a cluster with both some sales employees and others that tested positive. For this particular person that was hospitalized, family members can't say that there was any other type of contact or exposure that they noticed except for that exposure at work. So because of that, they did report that illness to OSHA and then had to also report that fatality as well. So when we're reporting, I'll go through this. There's going to be 3 things that have to happen before we possibly need to report to OSHA. The first is that it could be COVID related. So we need to know that was it actually COVID or was it someone that was just sick? And we'll know that it's COVID because they're eventually going to have a lab test. The other case is, was it defined as work related? And also if that case involves the reporting criteria. So you could test positive and actually stay at home and recover, and that would be fine. But if you had more than first aid attention, if it did require a hospitalization, then that's the point when it would be a recordable accident and potentially reportable if it did require a hospitalization. So we want to make sure that we are filling out our OSHA 300 log at that point appropriately, and then we may need to actually report to OSHA, like I said. When you're trying to evaluate whether a case was work-related, that's going to be really hard to do when it comes to a pandemic. Can you note whether that exposure happened here or was it personal exposure? So all OSHA is looking for is, did you do like basically a mini investigation? Did you at least ask a couple of exploratory questions to figure out whether it was at work or not? And by that, they're really just asking you to ask those questions that are on the screen here. If the patient or your employee is still able to, it would be nice to ask them if they believe how they contracted it. Do they think they got it at work, or do they know that they've already had an exposure somewhere else? While respecting their privacy as much as you can, you just kind of want to ask about some activities. Have you traveled? Have you been out and about? Have you been staying home? And then also just, reviewing the work environment as well. So again, if you know that you've already had a cluster and more people are testing positive, this is going to be more evidence that this could potentially be work-related. So if it was at work, how would you evaluate that? Again, if you're having more than one case pop up, if your illness has been diagnosed shortly after someone else's case has been positive, these are all indications that it may have been work-related. So when it comes to injury reporting, when we are making these calls to OSHA, if you have a fatality, we are required to report within 8 hours. But if we have had an inpatient hospitalization, then we at least have 1 day to report. So it is important that we are following up with the care as people leave potentially because of COVID, or at least telling them that if anyone does end up getting hospitalized, that someone in their family can alert you, and that we'll know that you are keeping up with the reporting requirements. Unfortunately, this is one of those things that happened with this other fatality. This individual salesperson did end up getting hospitalized, but no one knew that they were hospitalized until the fatality had happened, and they were just telling them to alert them that that this person wasn't going to be coming back to work. So once we are notified, you can't help that someone didn't tell you sooner, then it's 24 hours from at least when you're aware of it is when you would be required to report. Okay, I also just wanted to talk about some HR and medical questions. I will say from the get-go, this is not my expertise. I am more focused on the environmental health and safety aspects, but I know when we're talking about all these things, HR is going to come into it, so I just wanted to address some of those as well. One of the bigger questions, or kind of all-encompassing one, is what health-related information can I actually ask my employees? Can you ask your employees if they have a positive result? Can you ask if they've symptoms?
Got another quick question for you. Sorry. Hospitalized or just taken to the hospital and then released?
Hospitalized. They've been admitted to the hospital required. If they've just been seen at a hospital and released, then you don't need to report.
Thank you.
You're welcome. Okay, close contact, whether an employee has been asked to self-quarantine, these are all questions that you can ask. And really it's, not necessarily your duty, but you just need to show that you are protecting your other employees. I had a dealership owner ask me a couple weeks ago, well, I know someone that tested positive, but they really need to work. Can they just wear gloves and a mask and come to work and socially distance? I was like, no. Why would you do that? I mean, you're knowingly putting all of your other employees at risk. Like, no, we can't. We should already be doing the social distancing and the masks and, wearing the PPE. This is not an extra at this point. The extra part at this point is staying home. And at that point, they'll have their paid sick leave that they should be using. So how much information can an employer request from an employee who calls in sick in order to protect the rest of your employees? So someone might be feeling sick for reasons that had nothing to do with COVID. Other people might be like, no, I do have, symptoms like fever and chills. So, normally we wouldn't really ask. We just say, if you're sick, you're sick. And if you want to keep with that policy, you can. ADA is going to cover employees that are asking some of those kind of more exploratory questions. But even if you ask them, it doesn't mean that you can share that. So that is the distinction there. All of this information that's being told to you as their supervisor does need to remain confidential and private. It's more for just you're in the know in case maybe this develops further. So if someone is saying, well, I have a headache and I have chills and I don't feel good, can I make you go home and require you to stay home? The answer is yes. The CDC has given us the power to do that. If you're looking at someone and it is clear that they don't feel good, send them home and make sure that they see their doctor. And can you actually require people to be tested for COVID? Employees may be able to require an employee to be tested if they have symptoms. That way they can assert whether they are back to work. So you could say you can't come back until you get tested. But again, there's different ways to do it with the TDSHS. You can either go with symptoms and just say if your symptoms have dissipated, I'm not going to require a test, or you do have the authority to require a test too. So just wanted to let you know you could do either. So do I have to have a doctor's note if someone is coming back to work? That way we can assert their fitness for duty. The answer is yes, you could use that. You know, with all things in the pandemic, are doctors going to have time to write doctor's notes at the moment? No. So this is the other reason why I'd like for you to motivate you guys to use the testing method, because with that test, with the 2 negative tests, it's basically your doctor's note to say that they're clear of the virus and therefore they do not have an active infection. Some other questions that I've had more recently have to do with hiring. So as I'm hiring people, can I screen for symptoms? And that way I'm just not bringing someone into my dealership, for instance, that maybe you know everyone there already, but you know, new wild cards, for instance. And the answer is yes, you can screen job applicants for the symptoms of COVID, but only after you've made a conditional job offer. So you can't just say it on one of your first interview questions, but like other, you know, medical evaluations that are out there, if you have a conditional offer that's there, then at that point you could screen them for symptoms. Others have asked, can I take their temperature as part of a pre-employment? And again, like other medical exams, you are technically allowed to as long as you have a conditional offer in place. Can I delay a start date of an applicant who has COVID-19 or symptoms? So maybe you've picked a start date and next week they're going to come, and sometime in between there they're saying, turns out I don't feel good. Yes, you can delay the start date. The CDC is going to say no one with symptoms or positive case should actually be on site. So to do that, just go ahead and delay the start date at that point. I kind of mentioned this example already, but could your employer, could you guys delay a start date or withdraw a job offer because that individual is 65 years old or pregnant, which would put them at a high risk? And I think we can guess the answer. No, absolutely not. Just because someone is at a high risk category does not mean that you can withdraw your employment offer. All it means at this point is that you could consider options. So maybe they telework, maybe you can make accommodations before they start or on their start date, but it doesn't mean that you get to withdraw your offer. All right, that was my COVID talk. So I was going to transition for the last portion of this call with other regulatory items, but just wanted to look back on COVID real quick before I move on. All right, let's do regulatory reminders. These are going to be those other OSHA regulations that already existed before the pandemic. So some of this is maybe already familiar to you guys. I wanted to mention the top 10 OSHA citations that are out there. OSHA's fiscal year is October to October, so this is still the 2019 top 10. Fall protection was number 1, and I will say that this top 10 includes the 3 different divisions of OSHA, which is marine, construction, and general industry. I mentioned hazard communication earlier about container labeling, and that's number 2 that's on here. Respiratory protection, which is always, you know, hugely important, and personal protective equipment are also on the list here. So we'll talk about forklifts as well, but these are, you know, the no-nos out there that people have been breaking the most frequently. The reason why we want to comply with OSHA is, of course, to have a safe workplace for our employees, but also because we know that there's OSHA fines that are associated. The OSHA fines will increase by about 1 to 3%. It just goes with CPI every year. This past year, it was only at 1.8%. So you can see the maximum penalties that are out there. Obviously, if we have a willful or repeated citation, then that is going to be very expensive versus a serious or other serious, which is going to start more typically at around $10,000 up to $13,000 and up from there. I mentioned some of the record-keeping requirements already with that OSHA 300 log, so I just wanted to touch on the other accident paperwork that we do need to be keeping on site. Any type of accident that happens should be documented. Most notably, it's with your workers' compensation form, or you could also use that OSHA 301 form as well. With all those individual, you know, injury reports, that is going to get consolidated into an ongoing OSHA 300 log. So I mentioned that if it requires more than medical attention, if it requires a hospitalization, stitches, etc., then this is going to be a more severe injury or illness that needs to be added to your log. Within 7 days of those more severe injuries, it does need to be added to the log. This is an ongoing record that you would be filling throughout for 2020 this year. The OSHA 300A form is a summary of that 300 log. So basically all those individual row items that you're making on the log are going to be summarized on the 300A form. You're only doing this at the end of, the year basically to take a look back at the summary of injuries that have happened. So in January of 2021, you're going to look back at all of your injuries for 2020, and then you're going to fill out that form, which does need to be posted between February 1st and April 30th every year. Another topic is Tier 2 reporting. This has to do with the amount of chemical storage that we have on site. If you have more than 10,000 pounds of a hazardous material, then you need to report a Tier 2 file. The Tier 2 file gets reported to the TCEQ. That's the agency that manages this. And basically the whole point of having Tier 2 is to let our local emergency planning committee know what types of large storage of chemicals that we have on site. So your LEPC is going to be your fire departments and others that would be responding. If we suddenly had a fire at your dealership and you have a 5,000-gallon gas tank on site, they need to know that for their own protection. So that's the point of having the Tier 2s on file. If we have a large amount of chemical storage, the state wants to know about it. So anything that is considered a physical or health hazard, and again, more than 10,000 pounds or 500 pounds of an extremely hazardous substance, would need to be noted on this type of report. This report is due every year on March 1st, so we just need to keep up with it on an annual basis, and it is reported electronically to TCEQ, as I mentioned. As for SPCC plans, this is a spill prevention, control, and countermeasure plan. If you have a large amount of oil storage, and for this it's 1,320 gallons of bulk petroleum products, you more than likely are going to need an SPCC plan in place. So with this, we're talking about anything that's in a 55-gallon drum or larger. So any of your oil tanks, any of the oil drums, brake clean, anything that's petroleum-based technically needs to be added to your plan. Not only do you have to have a written plan, but it needs to be in place and signed by the managers on site. Your oil personnel, the verbiage they use within the regulation, need to be trained once a year, and you have to have a monthly inspection of the tanks and drums themselves. You're basically looking to make sure that if you had a spill in place, that you're preventing it, but all that's outlined. And this plan has to be, this plan has to be reviewed every 5 years, and that's because your oil and tank locations may have changed, so we do need to make sure that your tanks are updated. I will say that this is going to address your above ground storage tanks and drum storage. So your underground storage tanks wouldn't be on your SPCC plan, but there are requirements for USTs. They've gotten pretty stringent over the years. One of the ones that's easy to recognize is employee training. UST underground storage tanks require a class A, B, and C trainer. So there's 3 different types of employees that need to be trained with USTs. The owner, general manager, the manager, like your service manager, and also the actual person that uses the underground storage tank. And you need to have at least a Class C trained employee on site at all times while your facility is open. So I'll spend the next couple of slides talking about body shops and our collision centers that are out there. Collision centers, comparatively to a service department, just have more regulations because they're doing a bit more risky work. They are actually wearing the respirators that are out there, using the welding equipment, painting, etc., which is going to have more safety precautions to keep in mind. One of them that we sometimes forget about is having an air permit in place. The state of Texas has a permit by air rule, so that's the 106.436 air permit. And it just means if you have a certain amount of a paint process on site and a paint booth, that you then have the permit in place. We need to be considerate of the paint waste disposal process, how it's getting tracked, what type of paperwork, and if we are keeping all that documentation stapled together. E-manifesting is going to become required in 2021, so that is rapidly approaching. I know in the past we've had our paper documents of our manifests for hazardous materials that are getting picked up, but they'd like us to be moving into the digital world for that, which will happen next year. Paint mixing rooms and their cleanliness is one of the first things that OSHA is going to take note of whenever they're on site. I mentioned having a fresh air system for your painters, so evaluating whether you want a fresh air system, you're going to use respirators like a full mask or a half mask respirator, and also those N95 masks. All of those are going to have different requirements, so it's just which process you're going to use on site. I mentioned having those Appendix D voluntary use forms, so whether we have those signed for those that are wearing respirators with the collision or with salespeople in the front, we've just had different uses for those respirators with the pandemic. And then we'll talk about a respiratory changeout schedule. If you are wearing the half mask or full mask, you may notice that we have those thick cartridges on the outside. Those do need to be changed out about every 40 hours. So we actually have to keep track of that with documentation. And I'll get into fit testing and medical evaluations in just a little bit. Also, as we dispose of our paint and other hazardous materials, you may need a T-clip test on site. It's a toxicity characteristic leaching procedure test. Basically, it means, can I throw this in the trash? If I throw this in the trash and it's considered hazardous, that's bad. But if we know that it's non-hazardous, you can't throw it into the trash. How do you determine whether it's hazardous or non-hazardous? You have that T-clip test. So you're basically just taking a sample and sending it to the lab. So that can be on file as well. So let's talk about respiratory a little bit more deeply. And for this, I am focusing this conversation on our painters, those in the collision shop, and kind of removing the pandemic and salespeople and all of that out of this conversation. So when it comes to respiratory protection training, if they're wearing a respirator, they need to be trained on that. How often does respiratory training need to happen? Once a year. How often does someone need to be fit tested? If they are wearing a tight-fitting respirator and they don't have Appendix D signed, that's also once a year. And when do you fit test someone? You can only test for the fit of the mask after they have a passing medical evaluation. So how often do you have to have a medical evaluation done? That's going to be technically just once. I know that if you've had a painter that's been a part of your dealership for 5 years, 10 years, a very long time, it is nice to have those periodic check-ins with the medical evaluation, but at least the way that the OSHA regulation is written really is just one time that someone needs to be determined whether they would be medically fit. If you've had a noted change in health, if someone develops lung cancer, for instance, or has a significant weight gain or weight loss, then you might want to repeat that medical evaluation and the fit test, because especially when it comes with weight loss or any defects or I shouldn't say defects, but deformities or any changes to the face structure, then obviously that's going to affect the fit of the mask as well. So if you're doing a medical evaluation, you can send someone to an actual place to do it, like Concentra, or others have actually just gone online and used the 3M RESP exam system. So this is the workflow. I know I said a lot of training requirements right now. The first thing that you have to do is that medical evaluation, because you need to know whether someone is fit enough to wear the mask. Once you've been determined that they're fit, we need to do some training about how to wear that mask appropriately. Once you have completed that, then at that point they're ready to wear the mask, so we just need to test for the fit of it. So again, just added some verbiage down the bottom that OSHA has relaxed their enforcement on this. We have tried to call the OSHA offices, because the thing is, for someone like me that does do this type of training for fit testing on site, we haven't done it over the last 3 months. And we've done that because we're trying to socially distance even ourselves and our consultants from our painters that are out there. And you can see this example of this Bitrix hood. Sometimes we're putting a hood on someone, which is only leaving a couple of inches in front of their face, and changing that hood from the next person to the next isn't, the best thing to do during a pandemic. So because we can't, socially distance appropriately, OSHA has allowed for the relaxation of enforcement. I will say that when I called the OSHA office about this directly, they did say that if they have a specific complaint, they have to come on site, they have to evaluate it, and if you haven't done your medical evaluations, or at least the fit test, because you can always do your medical evaluations because you can do those online, but at least if you haven't done the fit test, they're just going to ask some questions, and they can still technically fine you for it, although they're going to try and use their discretion. They're going to try and be as helpful as they can as we're working through the pandemic. 6H is another requirement that's out there. This was EPA regulation that happened back in 2010 and 2012, so it's been a while at this point. But basically what it's saying is you can no longer spray paint just in an open area. Believe it or not, there wasn't necessarily a regulation that prohibited someone who's wearing a respirator and spraying paint in one area to having the body tech right next to him who isn't wearing a mask and is then exposed to that paint. So they figured out that's probably not the best thing to do. We need to have a little bit more structure about where paint is sprayed. So because of that, they enacted a 6H regulation. They call it 6H because it's subpart HHH. And with this regulation, you can see the 4 things that are required. There's going to be some paperwork involved. We do need to notify the EPA that you are a body shop. We need to make sure that the filters that we're using are 98% efficient, so they need to be HEPA filters on your booth, and also that the equipment that you're using are HVLP. When we're using a paint gun cleaner, it just can't create a mist, so we just need to be mindful of that. And then the HVLP guns themselves, was there a picture of that, need to be that high efficiency, low pressure. All of the paint spraying needs to be done within a filtered enclosure, so it can either have 3 walls or 4 walls, depending on how large of a piece that we're painting a whole car. It needs to have 4 walls. If you're doing just a piece of the vehicle, for instance, then it only needs to have 3. But your painters also need to be trained, and they need to be trained every 5 years on 6H requirements, and basically they're just being taught of how to spray paint efficiently. If you've had any changes in ownership, then we need to update your 6H notification with the state as well. So I mentioned some paperwork. There's other paperwork that's out there. We just want to make sure that you have it. One of the first things that we ask as consultants that are coming in for third-party audits is doing an audit of your paperwork. This is important because paperwork is black and white. You either have it or you don't. So it's super easy for regulators to actually fine for missing paperwork, I should say. If you have someone doing AC 609 recovery work and working with AC systems, then you would need to have that training certificate on file. You also need to register your AC equipment. You need to be doing a hazard assessment for each of those job positions that are out there. For the state of Texas, they're really picky about tires, so they're actually tracking where your tires went. If you can't prove that your tires got picked up and that it actually went somewhere, then that's bad. So there's actually 2 pieces of paperwork that come with any of your tire pickups. So you just want to make sure that we have both that are stapled together. And that's the same for your waste manifest. Any of that waste getting picked up is you're going to get a sheet that says, the vendor has come on site to pick it up, and then you're going to get another sheet that says this is where the waste ended up. All of those items need to be stapled together and filed on site. Your lists on site should be getting inspected once a year, so those annual reports need to be kept on file. I mentioned those T-CLIP results, medical evaluations, 6H, those Tier 2 reports that I just mentioned, along with those UST training certificates. This is all items that we need to eventually prove to a regulator. So we hit about 12 different regulations just when it comes to paperwork. We have what we call our KPA yellow box. It's just a convenient box to keep all of these items together. Use whatever is going to work for your dealership. We have had other groups that have switched to digital receipts, and that works as long as your management team is familiar with how to grab this information. If OSHA's on site, one of the first things that they're going to ask is paperwork, because again, it's super easy to know whether you have it or you don't, and they're looking for a reasonable amount of time. If it's taking you 30 minutes to find a used oil receipt, we did not do a good enough job. If it's taking a couple minutes, that's going to be pretty reasonable. I also just wanted to mention SDS access. So a chemical inventory needs to stay updated with the chemicals that are coming on site, and we need to know how to access that inventory. So rarely people are keeping the huge 3-binder, or the 3-ring binder of all of your SDSs. It's just not going to be the quick way to find things. Nowadays, we just go to Google. If you want to keep your inventory electronic, you can. As I mentioned, it just needs to be able to be easily accessed. So keep that in mind. It doesn't, if you have a password, it needs to be communicated very clearly. So if you're going to have those SDS posters, just make sure that you do have them posted above computers and all of your employees are familiar of where to find these quickly. So same thing that I mentioned, when that OSHA inspector came on for that fatality, they were looking at the Clorox disinfectant, wondering if it was in their chemical inventory and wanting a copy of that SDS. We were able to pull it up quickly, but if you can't do that, then that's when we can get in trouble. I also just wanted to mention some general required training that's out there. Every employee at your dealership is going to need some type of training. As controllers, I'm sure you guys are aware of that. It's just the level of training, and again, documentation. Some of this is going to be repeated frequency of the training, which we just need to note, and that way we can provide the training roster, certificates, et cetera, if they are ever requested. So every single employee is at least going to need 2 things: a new hire orientation that says this is how you do your job, and emergency response. Everyone should know how to respond to an emergency. From there, I kind of divided this up between the different departments, and because each department is going to need a different set of training. When it comes to the service area, you're going to need to know emergency response, but you're also going to need to know about hazard communication. At that point, you're wearing some type of PPE, you're dealing with the lifts, and you are a new hire, so you would have had training as well. For parts, it's a bit different. They could be shipping hazardous materials, so they would need DOT. They could also be wearing PPE, and they're picking up and moving around lots of boxes and equipment, so backcountry training is always a good idea. I mentioned with collision some of the requirements already, not only hazard communication, emergency response, fit testing, respiratory protection, and PPE. The other item on here is that SPCC training that I mentioned earlier, and you would only need SPCC training if you did have an SPCC plan in place, which may not be every dealership, but is usually a good bit of them. All right, rolling to the last couple of slides, I just wanted to touch on forklift safety and making sure that anyone who's operating the forklift is actually certified to do so. So there's actually 2 portions of training. Excuse me, there's going to be what we call a classroom portion and then also a safe driving test. So we actually need to have both parts. Classroom portion can be done online. Safe driving test is someone literally standing there with a checkboard watching them drive around. As long as they can say that they were satisfactory into what they passed, then they passed their safe driving test. Those certificates do expire every 3 years though. So we just want to make sure that we're keeping up with that. We do need to have a written forklift program. We also need to have the safe driving rules that are posted. Little things like the roof. I know sometimes we add a piece of cardboard just to keep the sun off of us, but we can't have that covered because it can't get in the way of your visibility when you're using the forks. The kicker that almost everyone is not doing, but they should be doing, is a daily forklift inspection. So we need to make sure that this equipment is in good condition, and you can only prove that it's in good condition if you're keeping a log of it. We need to be mindful about where we're keeping the keys. That way not anyone can just jump in and drive off. We need to have it parked correctly. And again, we just want to make sure that we're using the forks themselves safely and that they're not going to be overloaded. The last one I wanted to mention was golf cart safety. And I know you're thinking it's sort of nuts for me to be bringing this up, the pandemic and a golf cart, but some of the most nastiest injuries that we've seen on site have to do with a golf cart. So if you do have these on site, it is imperative that you guys are keeping up with safe driving practices. I know it's easy to feel like it's a little toy, we can drive really fast, we can cut corners, but we can't forget that golf carts don't have seatbelts. So there's nothing keeping people inside. You know, who's riding on the golf cart varies between dealerships. We have some to where it's, you know, a huge campus. So it's an efficiency improvement to have it around. I can understand that. Some are including customers to kind of drive around a lot, and at that point you got kids on the lap, other people kind of hanging on. So again, just need to be driving very, very safely. We did have a recent fatality with a golf cart as well. This was right at the start of the pandemic back in March. We had a lube tech, and I think this dealership in particular, it wasn't a very busy day. There was a vendor that was going to be coming on site, so they needed to make space for them, so they were moving cars. They asked another lube tech to help move cars, so they did. So they were riding back and forth within the golf cart. Unfortunately, you know, you can see on this version, we have seats in the back, seats in the front. The person who was driving just drove a little too fast, cut the corner, and the 2 people in the back spilled out of the back. When he did it, unfortunately, this employee hit his head on a concrete curb, just at just the right angle to require a hospitalization. And at that point, he was later declared brain dead, which you would never think would happen from, you know, a measly golf cart injury, but they do. So to make sure that your golf cart is driven safely, you should have a program in place. I know it seems crazy to make sure that they're trained on how to drive this correctly, but you do. And more importantly, if anyone is driving unsafely, you've got to call it out. Because if there's a bit of horseplay that happens once, it's going to happen again. And we just want to stay consistent with that so that those more severe injuries don't happen. All right, I also just wanted to note some of the COVID resources that are out there. Some are going to be from the CDC. I know we've had NATA guidance. Fisher Phillips has been a great legal guidance that we've just happened to use at KPA when it comes to HR and COVID. They've had some great blog posts and other items to ask some more in-depth questions. So as you can note, KPA is providing a compliance solution from basically the sales shop all the way to the back of service. So we just have compliance solutions for each part of the departments that are out there. I know that was a long talk, so thanks for hanging in there with me, everyone. I really appreciate it. I know that, again, things have changed so frequently, so it's kind of important to know what happens today. I know that there's going to be unique scenarios that are happening between the positive cases and just wanting some self-assurance as we're making these decisions. But the one takeaway I really wanted to enforce with everyone today is getting a program in place. And if you don't have a written program, you really, really should at this point. Not having a written program in March and April, maybe in May, people were being a bit lax about that. I have seen zero enforcement on it, just to be clear, but it's only going to better help you guys when it comes to possibly having regulators on site or any legal actions that could come out of this. If there are clusters, if anyone feels that, we aren't doing enough to protect them, this is a specific document and protocol that you can point back to that says, we did think about this. We didn't just, have a couple emails. We had a thoughtful conversation about it and did take everyone's positions into consideration.
Well, thank you, Amanda, for your presentation today. One thing I did want to kind of add on just as we wrap up today, and obviously I think with everything that's happening, we unfortunately had to make the decision that we're not going to be holding our October in-person event that we normally have in San Antonio. I think our intent is to continue to have these kind of monthly Controllers Roundtable webinars. So we are going to continue to be looking for some opportunities in the coming months to have additional events. I do kind of want to offer up to the group, if you have if there's any topics that you kind of want to see presented on during 2020, or if you're feeling some COVID fatigue, please let myself know or reach out to Katie, or just respond to one of our invites and let us know your thoughts on any ideas, or if you're kind of wanting more COVID coverage. We're kind of go back and forth if this is a topic that's getting a bit exhausted, or if there's really a legitimate need out there. We obviously realize that the situation is kind of evolving. It seems like from week to week, it's changed. So please let us know if you have any thoughts about our next Controllers Roundtable event. And I think with that, I think we're really close to the end of the time here. Again, I want to thank you, Amanda, and KPA's partnership in putting on today's event. We really appreciate the information you brought to the table today.
Thank you for joining us. To stay up to date on all the webinars for this series, please make sure to follow our CRT page for more information. Link is in the description below, along with other important links, including our social media. If you want to see future Gorman Trubitt Dealership Controllers Roundtable webinar series, subscribe and hit the bell icon for notifications. Thanks and have a great day.